Good afternoon, everybody. We'll be treating another topic. So we are treating mastitis. We have to understand what mastitis is. Okay, how are you? I hope you're doing fine. If you've been hearing my voice and you've not started following me, please do well to follow us. Subscribe in our YouTube channel, CC Natural Therapy. It will help you take in charge of your health. Let's go ahead. We have to understand what mastitis is today. Mastitis is a condition that affects many breastfeeding mothers, many breastfeeding women. Comprehensive views of it is what we'll be looking at now. Mastitis on its own is an inflammation of the breast tissues, which can actually be caused by bacterial infection. It's almost common in breastfeeding mothers, though other women experience that in certain stage of their life, especially during the first week or after giving birth. Okay, all right. So this chronic mastitis has a lot of symptoms that actually help you understand that is what is going on in your life at a particular time. Okay, among the symptoms of mastitis, we have pain and tenderness of the breast. The achings and sharp pains in the breast, which can actually be so severe. That you'll be wondering if you're having tumors, if you're having, okay, it can actually bring forth some redness and swelling at a particular portions of your breast. Okay, so maybe you'll be thinking you have infection, you'll be thinking you have all these local charms, whatever, on your breast. No, this is mastitis. Okay, the redness of the breast parts or swelling is as a result of infected areas that the bacteria must have taken as its host. The red and swollen and warm up to the touch of your breast. Okay, it can actually give you those informations you want. This is symptoms. These are symptoms you're looking out for. If you have it, you know you have mastitis. Another symptom that mastitis can actually bring forth is fever. When we talk about fever, the fever that has up to 101. Okay, this can actually bring forth a temperature of 38.6 degrees centigrade or 101.5 Fahrenheit or higher. It can actually show forth that you have mastitis. The chills, the feeling of cold. Okay, it can actually bring forth feeling of cold in the body at a particular time when the temperature is a bit high. These are signs and symptoms that mastitis is in the system or has actually taken its place there. Okay, another one is fatigue. Extreme tiredness and exhaustment is what you can be feeling at a particular time. This has actually proven to you that you have mastitis as a woman or a breastfeeding mother. Okay, the flu-like symptoms that can actually come forth is the headache, you understand, the muscle cramp that someone might be having at a particular time. Okay, we talk about the muscle ache, cramp that someone might be having at a particular time, generally feeling of unwell. You'll be thinking possibly you have malaria, or you have typhoid, or you have whatever infection that has a lot of flu-like symptoms. Do you understand? So know that mastitis is there. I will actually pin that part that has redness. Sometimes the redness or swollen gives you that clear signs already, or the pain and tenderness of that breast gives you that very sign you're actually looking out for. You can go through ultrasound and check if there is mass there. Through the ultrasound, the sonographer will help you identify what is going on in the breast and be able to diagnose, be able to give you the prescription you need at that particular time and make you much more better. Okay, causes of mastitis is what we'll be treating now. There are several causes of bacteria. It could be infection, usually caused by Staphylococcus. Staphylococcus aureus bacteria. If you have this UTI, it can actually generate itself, have its movement from the vagina to the bladder, through the bladder to the kidney, down to the respiratory tract, and then take the regions of the breast. The upper respiratory tract can actually take up there, and those regions of the breast will actually collect its own part and then result to this mastitis. So make sure you go ahead and diagnose yourself of any kind of infection that you might be having, especially UTI, so that it will not generate to the level of this and then you start thinking otherwise. So please do it now that it's a bit lesser. Do it now that you've not been able to see mastitis in your system. Always make sure you diagnose yourself of UTI or sexually transmitted disease. You'll be able to clear it from your system to avoid having certain issues in the future, especially that of mastitis or having breast cancer. Okay, we'll go ahead with the clogged milk ducts. Okay, milk duct can become blocked, leading to inflammations and infection. This is another cause of mastitis. The poor breastfeeding technique, okay, incorrect or positioning can actually cause nipple trauma, leading to mastitis. When a child is not breastfeeding very well, you understand, when the nipples are being inflamed due to the gums that the child has used in biting the mom and the rest of it. So those incorrectness in breastfeeding can actually lead to mastitis when the milk duct has already clogged. Do you understand? It can actually lead to all this that we are saying now. All right, we'll talk about the infrequent and complete breast empty. When the breast is empty, not fully emptied, the breast can actually result to some of this milk status. It can actually result to a lot of reduction, or can lead to a lot of surge of milk in the breast that can actually finally lead to mastitis, increasing the risk of mastitis because there are so many prolactin still in the system of milk that has been secreted, that has not been dried up because you have stopped breastfeeding. It can actually lead to mastitis. So take note of all this and make sure that your system are clear. What we're actually running away from is to avoid things that leads to breast cancer. Breast cancer is going so well. So as we are talking of mastitis and the possible cause of mastitis, make sure that you be able to understand the difference between breast cancer, the tumors there, and mastitis. So being able to get those things on, being able to understand it well. If you don't understand me, you can easily chat me or comment on that section. Comment section will be able to answer you. If you need the advanced method or advanced information on this, you can easily chat us on our WhatsApp, and we'll continue to give you the answers, and you'll be able to take charge of your health. All right, we're talking of the treatment. The basic treatment to mastitis is an antibiotics. Antibiotics, the prescription can actually help you. You can actually chat up, we'll give you the prescription based on the diagnosis you've reported. We'll be able to give you the prescription you need at a particular time. The pain relief will also help you get what you need at a particular. Okay, as I've said, among those treatments of mastitis, I've told you the antibiotics is what, a particular antibiotics is what is being used in the treatment of mastitis, in addition with pain relief. Okay, another natural one you can actually do at home is the rest and hydration. So ability to get plenty of rest and staying hydrated all the time help the body to recover. Make sure as you're feeling this, add up to the water intake. Make sure your body is hydrated at a particular time. One compression of water applying direct to the position where those mastitis is being felt. Do you understand? Or where your sonographer have been able to identify for you. So just make sure you are applying some warm water around there, the affected area. It will help to relieve pain and promote healing and recovery so fast. Again, it's frequent breastfeeding. Make sure you're breastfeeding your child at a particular time. It will help those breast milk that has clotted there to be able to leak out, so that the baby on its own will be safe, yourself will be safe. The inflammations associated to mastitis on its own will be cleared. The prevention method is proper breastfeeding. You have to do proper breastfeeding, that's prevention of mastitis. You have to do frequent breastfeeding at a particular time. It promote the nipples to be able to go well, to be able to just make sure that the nipples are always placed directly to the mouth of your child. Proper breastfeeding care should actually be advised at every given time. Thank you. addition of rest. Make sure you increase your rest at every particular time. Thanks a lot.